A deadly COVID variant tearing through Brazil has that country's medical system at a breaking point. A CBS News team traveled there this week, and as Manuel Bojorquez reports, the situation is dire.
Vila Penteado Hospital in Sao Paulo is not only full, it no longer accepts anyone but COVID-19 patients. Dr. Daniela de Jesus says the virus's victims are getting younger, and once they are here, the odds are against them.
In your experience, how many of these 9 people in this one room will recover or not?
Menos da metade. Menos da metade se recupera.
Less than half will recover. You really get the sense of worst case scenario being in this hospital. In this room, people are being intubated. In the other room, we saw someone getting chest compression.
It's exhausting work, emotionally too.
Na maioria dos casos, esses pacientes, a última visão é minha.
You're the last person they see before they die, some of them.
For many here, suffering is taking different forms. The virus's economic toll means food insecurity is surging, especially in the favelas, lower income settlements. This young man, Antonio, made it clear to us what he'd have to do if it weren't for the daily community lunches distributed here.
If you did this, meaning robbing people would be the other option.
Quando você faz assim, roubar seria outra opção?
Outra opção que é falta de oportunidade, sem trabalho.
Because there's no opportunity, no oportunidad.
Much could have been done to prevent things getting so bad, says Duke professor Miguel Nicolelis. He blames President Jair Bolsonaro's lax pandemic response, especially in light of a more contagious homegrown variant known as P1, driving the surge here.
It's like having a gigantic nuclear reactor getting into a chain reaction out of control and exploding all over, the neighborhood. It's not only going to kill Brazilians, it could kill people all over the world.
There is sobering news about the variant that originated here. The country's Public Health Institute, Fiocruz, says research shows it is mutating itself into a form that could evade antibodies. That worries scientists who think it could become more resistant to vaccines. Manuel Bojorquez, CBS News, Sao Paulo.